South Africa is edging ever closer to the 200,000 COVID-19 cases, with record daily numbers shooting up to 9,000. Is a return to a hard lockdown really the answer? Good evening, I'm Aldrin St-Pierre, and this is Unfiltered. It's just over 100 days since the country embarked on a nationwide lockdown, and there are escalating calls for South Africa to revert back to another hard lockdown as COVID-19 numbers continue to climb at a fast rate. Can we afford it? Economists are saying that this could put further strain on the already ailing South African economy. Tonight we ask you, should the country consider another hard lockdown? Please share your thoughts using the hashtag SABC News Online and hashtag SABC News Unfiltered. Our guest tonight is MEC for Health in Gauteng, Dr. Bandile Masuku, as well as Professor Lucille Bloomberg, who is the Deputy Director at the National Institute for Communicable Diseases. And then later on we'll be joined by Angelo Fick, who's the Director and Researcher at Alwa Socio-Economic Research Institute. Okay, let's just quickly listen to this bite before we introduce the MEC of Health in the province of Gauteng.
We're in the midst of a new surge of infections. If we take the necessary precautions, we really do not have to be afraid. The right to life for us is important, and it is sacrosanct. But at the same time, we've also known that we've got to protect livelihoods as we protect life. And in doing so, we've got to create a really good balance between the two. We're not the only ones in the world going through this very testing moment. Many other countries are going through this testing moment, and the defense that we've always said we should have is to change our behavior.
Okay, let's introduce into the conversation the MEC of Health in the province here in Gauteng. MEC, good evening and welcome to Unfiltered. Let's just start off, MEC, this conversation by sending our condolences to you as well as the family of your colleague, the Kokta MEC of the Northwest. We have the MEC of Kokta in the Northwest, MEC.
Let me just move. Sorry from this person.
No, thank you so much, and thank you for having us on your show. It's really very sad news. It's sad news that we receive these reports of the passing away of our colleague from Northwest, and also being a person who loses the battle against COVID. And we like to express our heartfelt condolences to the family, to the Premier of Northwest and the colleagues in Northwest and everyone in Northwest. In that regard.
MEC, with the death of the MEC Gordon, this just points exactly to this conversation that the country and the globe has been having around the seriousness around COVID-19 and how seriously we should be taking this pandemic.
Yeah, we shouldn't have actually reached this point where we have to decide on people passing on and then people to show actual seriousness, because we have seen and witnessed how devastating the pandemic has been in many parts of the world. And I think as South Africans, we should take that into account and make sure that we don't get to that point. Mm-hmm. And I think it's very sad to lose lives, because it's not only lives as in statistics. These are parents, these are fathers, these are mothers and grandparents of many. Yeah. So it's a very sad moment.
Yes, indeed. MEC, let's move on then to focusing on Gauteng. Just over 63,000 cases that has been confirmed here in the province. Is it still the situation as confirmed by the MEC, by the Premier, last week, that Gauteng has the most number of active cases? Is that still the case?
It's still the case, and I think with that in place, we would know that we'll regard Gauteng to be an epicenter, because we have the highest number of active cases that have been reported. And I think it's still the same. And I think the Premier did indicate that we are now within the storm. The storm has actually arrived, and it's all upon us to actually weather the storm.
When the Premier mentioned that, there was an expectation that when Gauteng government goes to the NCCC, it will ask for a hard lockdown, but I see that this has since been refuted.
No, we have, remember that we did engage in a series of consultations with several stakeholders, including religious leaders and political leaders in the province. One thing that was certain is that we needed to create a balance between opening up the economy and also saving lives and reducing the rate of transmission. So some of the recommendations that we brought to in front of the NCC, they are just about the issue of strict adherence to some of the regulations of lockdown, which will help us in that main.
Was there any proposal around the sale of alcohol, and there be a change in terms of what times alcohol can be sold?
We have put across a series of proposals to the NCC, and some of them are purely on our behest as a provincial government, particularly as it relates to the usage and the sales of alcohol, the regulations thereof. Maybe one of the things that we are going to consider is how we're going to strictly actually regulate that part. The second part that we want is, the strictest thing is just to reintroduce the curfew, to reduce the movement within the province, and also to reintroduce the strictest restrictions across interprovincial actually traveling. And the other one is just the continuous regulating of crowd control in many of our social gatherings, particularly our weddings and funerals. But the social events must not be actually allowed at the current moment.
Yeah. When it comes to alcohol, what times are you looking into? And can you please give us an indication of what impact alcohol has had on the strain that hospitals are currently under?
The alcohol has got a very great function in terms of the trauma that we see in our trauma unit, and hence it becomes a big problem. So the issue of times must be actually reduced, and we don't have a specific a proposal at the moment, but the times must be reduced. The availability of alcohol also in terms of the places that sell alcohol should be limited in many respects.
Mm-hmm. Okay, and then just quickly, MEC, touching on the impact that it has had on the trauma units.
The issue is it's all about that the trauma units have actually been packed over the period of time, and we did see when we're on level 5 lockdown, we did see quite a reduction of all the trauma cases that were there, including motor vehicle accidents. So now with the beginning of level 3 lockdown, we have seen the increment in that rate, and it's something that is also related. But the MAC and our clinicians will provide definite statistics actually to that regard.
Okay, I'll go back to the hospitals, but just quickly, is the Gauteng government able to ascertain whether the opening or the reopening of the schools, as well as the taxis deciding to go on 100% capacity, whether that at all has had any impact on the number of active cases that we currently see in the province?
The schools, I wouldn't say that, because most of the people that have come in, your educators and learners who have been found to be positive have been found whilst it's a community-associated actual infection. But I think in terms of movement, that the transmission of this virus of COVID is also a function of movement. So the more people gather in groups and there's a lot of movement, that's how the virus actually gets transmitted. So these are the other aspects that we need to actually look at. But one thing for certain is that we might not be able to return and revert back to a hard lock, because our economy might not be able to actually recover from that. But there are other ways that we've put into place, which we're waiting for our specialists and experts to give us advice on. The one that I put across was the one on intermittent lockdown, which we have seen in many parts of the world. And we just want to see how we can maybe apply it within the context of South Africa. using the insight and the experience of all that we have actually garnered through the lockdowns that we have had.
Okay, with the curfew that you mentioned earlier on, would that curfew apply to businesses as well?
It should be, because it's one of those ways of how you limit actually movement, unnecessary movement, and the modalities of everything will be decided upon when we have actually completely decided and consulted with everyone who's actually affected by this decision.
Mm-hmm. Okay, so then let's quickly then touch on the issue around the hospitals themselves. We've seen videos doing the rounds, MEC, that hospitals have taken a strain. Some people saying that they are not being taken care of because there's not enough medical staff. And the other argument is that people being turned back and told that there are no beds available.
There is a bigger problem that we are seeing. I think we did accept and agree that we are feeling the pressure, and the system is actually generally under stress. And this is a stress that we see, which comes with the winter season and which comes also with the increase of the infections. By and large, is that we do see this, and it's something that we sort out all the time, every night, using our systems to make sure that people don't get turned away, people do get beds, and people do get triaged to an appropriate area. So it's one of the things that when you come, at one point you'll find that the casualty will be packed, but after a certain number of hours, when people have been sorted out, been examined and be assessed, then you can know that everyone goes to a particular area. And that's how we normally decongest the ward. So if you have not used to in hospital, you might think that it's how the casualty will look. But it's something that always, every time when you come on call, come in, you have to clear out the patients that you find there and assess and make a decision on them.
Just quickly, MEC, the capacity of private hospitals, though, because one celebrity, Somizi, was speaking about them trying to take a relative to certain hospitals, including private hospitals, and they were turned back there as well.
Yes, the capacity of the other things. Remember that when we talk about beds, we also talk about the availability of staff that will man the bed. And in the private hospitals, they do have a bigger problem of having staff shortage, which we also share. And most of the staffs that we have, we do share between private and public. So in a better way, in a better system, which we are trying to make sure that we make it work, is when we have a central bed management system where both private and public people sit and be able to direct which hospitals will be admitting, which hospital have beds. And I think it's a matter and the function of having a better administrative team that will actually manage that.
Okay, so thank you so very much for that. But we're still keeping the MEC of Health, that is MEC Bandile Masuku. We'll also be joined by the NICD just after this quick break. Unfiltered, as we have a conversation about the increasing number of COVID-19 cases. And as I said earlier on, that South Africa edging ever closer to the 200,000 confirmed cases in the country. And joining me now for this conversation as well is Dr. Lucille Bloomberg, who is from the National Institute of Communicable Diseases. We still have the MEC of Health, Dr. Bandile Masuku from Gauteng, also joining us in this conversation. Dr. Bloomberg, let's first start here. Do we understand why we've seen this escalation and this increase, a sharpshoot, some may argue, of the number of confirmed cases? On Friday, for instance, we confirmed 9,000 new cases.
I think the increase was inevitable. I think with the lockdown, we achieved what we had set out to do, which was to allow time to prepare health facilities. There's always some gaps there. But, it's inevitable as you release the lockdown in this phase of the outbreak and as people start to gather and go back to work and have contact with each other, you're going to see an increase. And we've seen an alarming increase, which is concerning.
What are some of the gaps that you speak of?
I think it's inevitable if you look at the how these outbreaks pan out in many areas. This is not unexpected.
Sure. What are those gaps that you speak of?
Well, I think the purpose of the lockdown was to try and slow transmission, health facilities to prepare for the inevitable surge, that other countries have experienced in cases. I think it's always a little difficult to know what you're going to expect, but the hospitals, as we've heard and we know, are completely overwhelmed. Mm-hmm. And I think there are gaps in oxygen supplies, in areas where patients need to be sent for more than just isolation. Mm-hmm. So mm-hmm. I think that is what we're looking at now.
Okay. MEC Masuku, do you agree that there are some gaps?
Yes, there are some gaps. And I think the most important aspect that Prof have said is that, in agreeing with her, is that, some of the modeling that we have done in terms of prediction and how the pandemic will turn out and pan out, were done also with the understanding that there will be some regulations that will still be strictly be enforced and be in place. Because in addition of slowing down the rate of transmission, it also tried to reduce the height of the peak, mm-hmm. To reduce it to a way that the system would be able to actually capture and be able to manage the cases that are there. Mm-hmm. But there are gaps that we have seen and the gaps that the modeling have actually identified, and we are seeing them now. Hence, the plan that has been in motion is to put up extra bed capacity in terms of field hospitals, mm-hmm. which will be able to close that gap actually going forward.
Does this mean building new field hospitals?
Yes, remember that we have a field hospital, a center that has got a quarantine and isolation center in Nasrec, mm-hmm. Which now we are putting up hospital beds, which will have oxygen capacity for the patients that are pretty much stable, who just require maybe observation and continuation of treatment. Because our view is to make sure that those who are quite sick might still be seen and be actually stabilized in our hospitals. Mm-hmm. So field hospitals by the main should be used for those who are stepping down. So we are putting up increasing the capacity in Nasrec, and also putting up, with the help of the South African National Defence Force, something around Ekurhule in Sinaba Stadium.
Yeah. Okay. Professor Bloomberg, the other point is that if we look, for instance, at the Eastern Cape, having the third highest number of cases in the country, do we know what some of the inefficiencies are in the Eastern Cape? And I saw an announcement this morning as well that the province has decided not to allow the great arts back to school.
So, I think the Eastern Cape, unfortunately, has a history of problems with their health system. I think it's not strong. Mm-hmm. I think coordination is extremely important in this outbreak. And I think when you have the surge in cases, you need to know you need to be prepared. You need to know where your empty beds are. The private sector, the public sector need to work together. I think the Eastern Cape and what we're seeing now is unfortunately speaking to many years of problems with their health system. And mm-hmm. I think COVID just brings it out. Yeah. So that's very, that is a problem.
What would you say it is that national government can do to come and assist the Eastern Cape, if they can at all?
Well, I think it's about resources. It's when you have the surge, it's really about making sure you have enough beds, you have a coordinated response. So there needs to be a much more coordination. I think it's quite fragmented from what I hear. So what could they bring? Resources, someone to coordinate the response. It's a tough question.
It is a bit of a tough one, and Prof, just considering some of the challenges that the Eastern Cape, for instance, is facing, and the announcement by the President a couple of weeks ago that when it comes to COVID-19 and having different districts moving between different levels, would you say that Eastern Cape is one of those provincial candidates, perhaps, that should be pushed up to a higher level?
I don't think increasing the lockdown levels is going to help. Mm-hmm. I think we have had to get what we can out of it. And lockdown, unfortunately, brings many hardships, brings lots of socio-economic problems, as we know. It's not the answer to problems in your health system. And when you have lockdown, your other health problems also get completely neglected. Immunization programs, TB programs, HIV programs, and the Eastern Cape has many of those. So increasing the level of lockdown is not really going to solve problems for us.
Okay.
I think we need to do a lot more than that.
MEC, do you agree that that's the approach that Gauteng is taking?
Yeah, I think it's a delicate balance that we need to have, and I think it's a matter of caution. And I believe that now we've got better insight on how we can be able to better apply the lockdown for greater impact, particularly on areas where we know that they might give us more problems of outbreaks, particularly the social gatherings and crowd control.
Yeah.
So the regulations around crowd control, should come back very strongly to make sure that we reduce the amounts of outbreaks. And the issue of the curfew also helps us to reduce the movement, and also the interprovincial movement will also be a bigger problem. So there are some regulations that, when enforced properly, we can be able to garner enough maximum impact actually from them in the reduction of the rate of transmission.
Would you be able to say, MEC, that if you look at it, for instance, at the various districts here in the province, that you have District D, including Soweto, and then you have the district that includes the inner city, where we see the highest number of cases in the province, that the reason that we're seeing those numbers is because of non-compliance?
It's mainly about that. It's mainly about increased movement. It's mainly about issues relating to crowd control, which is a big issue that we are actually facing. Some of the outbreaks that we have seen in Johannesburg, the region F that we actually mentioning, it was also post festival actually religious observation where these gatherings happen, and also some funerals that we have seen. So these are things that we can be able to enforce and control without, in a real sense, affecting the economy in a main.
Okay. And Prof. Bloomberg,
can I just say something?
Okay, sure.
I agree with the MEC. I think the release of the lockdown has given many the impression that COVID is getting better. But we're in the difficult position in this country that we've had to release the lockdown at a time when the surge has been expected,
yes.
And that's exactly what happens. But COVID is an invisible enemy. People don't realize the severity of illness in certain groups. They do need to reclaim some of their normality of their lives. Absolutely essential to go back to work, for children to have a safe place at school. There is overcrowding. So you have this imbalance. But very importantly, there are certain groups that are most at risk for complications of COVID, severe disease, and are more likely to have an unfavorable outcome. And it's those vulnerable groups that we need to protect. And people need to take responsibility for their own kind of lockdowns and protect themselves. And MEC spoke about funerals and gatherings. There are, those are situations where there is definitely an increase in transmission. And those who are vulnerable to complications should not be attending those. And we really need to reduce the number of gatherings, people attending them, and enforce the social distancing and wearing of masks.
Yeah.
That can go a long way in releasing of lockdowns to reduce transmission.
Okay. MEC, I know that you have to rush off. Just a quick closing remarks to people in Gauteng, and I guess any other citizen who's listening to this conversation and watching it.
Yeah, I think the most important aspect is just to continue to observe the regulation. These regulations are meant to protect lives. They're also meant to protect the economy. The more we are compliant with the regulations, the more the economy will actually remain open. And this is something that we want actually to see happening. But if the companies, if the public don't observe the regulations, then it becomes very difficult for us to maintain, the economy open. But also it means we are going to have a big problem of having to lose most of our loved ones during this pandemic. And I think just maybe the last one is to again express our heartfelt condolences to the Premier and the peoples of Northwest on the loss of their MEC.
Thank you so much for that, MEC Bandile Masuku. Thank you so much for your time, the MEC of Health in the province of Gauteng. We've come to the end of this particular conversation, or this aspect of the conversation here on SABC 3. But when we come back on the SABC News Channel 404, we continue the conversation, but now focusing on the economy as well as compliance that's expected from companies. And welcome back. We continue our focus on looking at the number of COVID-19 cases. As I said earlier on, the number edging ever so closer to 200,000 confirmed cases of COVID-19 in the country. Let's just look at some of the tweets that you've sent through. And remember that we're still in conversation with Professor Bloomberg from the National Institute of Communicable Diseases. Later on, we will be joined by Angelo Fick. Matthews Ramuaka says, no, the reason is that our society at large are suffering from poverty and loss of jobs. I will agree if the role of our government touches the society at large, but since it's difficult to do so, I disagree to go back to level 5. This is no longer on regulations anymore, but on people themselves. It's already out there. And Riat Umetzi says, lockdown would have been effective if our levels of corruption were low. It is quite visible that all efforts supply necessities to citizens get lost in the system. Hence, it will never be to the ordinary citizens' benefit to lock down because hunger would kill them. And Professor Bloomberg, just listening into that you have that sentiment that people believe that hunger will kill them, therefore it will be very difficult to adhere to the level 5 regulations, lockdown regulations.
Yes, we really cannot go up again with our lockdown regulations. And I agree, the socioeconomic implications are huge. I think many people can appreciate that.
Sure.
We need to impose, yes, I think what we've discussed, those at risk, those who are vulnerable, we need to reduce their risks of contracting COVID. Some of the measures that we can discuss.
Okay, let's just quickly then speak about the ability to test at the moment. How are we standing at the moment? Because there's also been some complaints where people say that they've been waiting and waiting for the results, and those results are taking forever.
So there is a shortage of test kits. The tests that are done are laboratory-based. It's a specimen from the nose or the throat, sent to the laboratory for what we call a molecular test, a PCR. It's dependent on the use of kits and reagents, and there is a definite shortage, not only in South Africa, but other parts of the world. We must prioritize our testing to hospitalized patients and healthcare workers with symptoms. We cannot do everybody, and those are the most important group because it informs management and infection control practices.
Can you just
so we can't do communities or hotspots.
Yeah.
We really have to prioritize.
Okay, Prof, can you just expand a bit on what you spoke about in terms of prioritizing those who present symptoms? Because what we see happening in companies, and we'll touch on some of the levels of compliance or failure to comply from companies' side, but what we've seen happening with companies is once someone is told that they've come into contact with somebody who has tested positive, immediately that person then goes to go and get their test done.
So prioritize testing is really to prioritize those who've got more severe illness, who are hospitalized. So it's prioritizing patients who are admitted or who've got more severe COVID, because it's important for informing management in the hospital and infection control practices. We can't do widespread community testing anymore for hotspots. That we need to move away from that. And then people in the community who are have mild symptoms, who don't have risk factors for severe disease, if they've got the symptoms, They must go home, try and isolate as best they can, and reduce transmission by some of the measures that we've discussed: distancing, masking, etc. We really don't have enough tests to test everybody in the workplace or in the community anymore. We have to prioritize our testing.
We have to prioritize the testing. Let's introduce Angelo Fick into the conversation as well. Angelo, good evening and welcome to Unfiltered. Just listening into what Professor Bloomberg had to say about we can no longer do community testing the way we've seen it done before during March as well as during April. But then how do we then have a conversation about those communities being actively involved in commerce?
Actively involved in, good evening, Aldrin, I missed the last word.
Actively involved in commerce. In trading.
Commerce,
Yep.
Right, trading, okay. Well, I think what we have always known, what we've known all along, is that there is going to have to come a time where people have to take individual responsibility. And some of that individual responsibility means people are going to have to take very, very careful precautions because in addition to what Professor Bloomberg just outlined about having to prioritize tests for particular spaces, there also has to be a kind of self-education, and people have to be educated to do exactly what she's indicated, which is to watch for your own symptoms and proceed to do the things that you can do until you can't cope and then get to hospital.
You put it so slightly, just in terms of getting into a hospital, and the conversation that we're having earlier on as well is how the hospitals themselves are under pressure.
As I indicated, to a hospital, not into a hospital.
Sorry,
so the
Angela?
majority of cases, just to mention, the majority of people who contract COVID have mild, uncomplicated disease and will recover. What they have to do if they develop symptoms, if there are tests available, we'll test them. If there is a shortage in that area, we will prioritize testing in the hospitals. But if they have symptoms, cough and sore throats and perhaps fever, can't smell, can't taste, they will isolate at home. It's likely to be COVID. Don't absolutely have to have a test if we're going to lose out on hospitals, and that's what we can do, and they can distance themselves for a period of time. That's really where we need to go in the outbreak at the moment.
Okay.
Most people don't have to go to hospital.
Okay, Angelo, earlier on we were speaking about Gauteng, and there were reports in the Sunday Times about Gauteng moving into a hard lockdown, and the MEC has now refuted that. But he was saying that they were looking at some curfews, which some of those curfews would have an impact on businesses. What do you think it is that the Gauteng government should be taking into consideration, considering that Gauteng contributes at least 1/3 of the GDP?
Well, I'm not here to give policy advice to the government of the province, but what I can suggest that people increasingly take into consideration is that they must pay attention to how this disease is not just about money, but it's actually about people's actual lives. I am finding this conversation very difficult, Aldrin, because I can hear my own voice fed back to me, so I really can't answer questions if I'm listening to myself.
Apologies.
There's some technical issue on your side.
Okay, let's just quickly go to an ad break and we try to sort that out. That's Angelo Fick. We're also in conversation with Professor Bloomberg from the National Institute of Communicable Diseases. And we continue our focus on the number of COVID-19 cases, as I've said earlier on, edging ever so closer to the 200,000 mark. But now we're also looking at the impact that COVID-19 has had on the economy. And in conversation with Angelo Fick as well as Professor Bloomberg. Angelo, let me go back to you. Last week we heard from the Premier of Gauteng saying that COVID-19 could cost the province at least 2 million jobs. What are some of the aspects that this is highlighting?
So I think what it's highlighting is that our institutions have not been well prepared for any kind of crisis of this kind. And this is, I think, something that South Africa is not unique in terms of. One of the issues that we, I think, have to do right now is not just adapt and want to go back to business as usual, but apply what Elaine Sari, a professor in the United States, calls emergency thinking, which is to begin to adapt our social institutions, whether they the institutions of the family, institutions of education, healthcare, the economy itself, to a world that is rapidly changing beneath us, because our habits of being, our habits of thought that brought us to this point are not adequate to dealing with this crisis, which means what one hears from officials, one hears from politicians, from business people, is often a kind of let's get back to business, reopen the economy, as if there's a return. And Sodom and Gomorrah is behind us. And unlike Lot's wife, we don't have the opportunity to turn around. The world spins forward. We need to move forward with it, because if we don't, we will have the kinds of demographic crises that we see in other parts of the world, where people have had these kinds of real eruptions into their social lives. Because mourning is not just a matter of individual deaths or large numbers of deaths. It's the social and psychological consequences for the survivors of living through this kind of issue.
And what we're seeing on social media as well, Angelo, a lot of people tweeting about losing family members to COVID-19, and you've now touched on the issue around the mental impact that this virus is having on people.
It's the impact on individuals, but it's also the impact on whole sections of our society. So individuals dealing with their own crises can build up individual resilience. But as we've seen with the HIV pandemic in the Midlands of KwaZulu-Natal in the late 1990s and early 2000s, those consequences do not end with the individuals. They stretch through the community. Now, if we're going to see the kinds of consequences that we have seen in New York and in Italy, in parts of South Africa, particularly in our highly dense cities in Gauteng like Johannesburg and Pretoria, the consequences will not just be an interruption to trade, and those consequences are real and we need to deal with them. The loss of 2 million jobs is not to be scoffed at. But the 2 million job losses will go alongside the loss of life, the loss of connections between people. And that, I think, is something that no amount of job saving is going to do. So, yes, it's important to begin to rethink economic activity and trade in the most unequal society in the world. But in addition to that, we dare not leave behind the very, very difficult work of building resilient communities during this crisis and through this crisis, because there is more coming. We know from other observers on different issues that the climate emergency is likely to visit a variety of ravages on various societies around the world. Ours will not be exempted from this. And so I think we need to start preparing ourselves as individuals, as well as our social institutions, to begin to adapt much more quickly and to begin to creatively invent new habits of being and new habits of thought. Because the vestigial forms of the past are not going to get us through this.
Professor Bloomberg, do you agree with that sentiment?
I agree absolutely with Angelo. It's a multifaceted problem. It's not just economy, it's not just health. We really underestimate all the other effects, especially the psychological effects on our society in every way. I couldn't agree more.
Yeah. Angela, I just quickly want to go back to you. You've touched on the issue of climate change. And what we've noticed during our elections as well is that from the politician side, at least, you don't get a lot of commitment towards climate change. I remember attending one rally, for instance, and at that rally there was a debate asked about climate change. And the person who was responding from political parties struggled to articulate what climate change is and the impact that climate change has on the people. So when we speak about building these resilient institutions, what exactly is that we're talking about, and how does climate change play a role in that? Using the experience of COVID-19, by the way.
We can use this experience. We can use the experience of our HIV/AIDS pandemic. But fundamental to all of this is critically literate education. And one of the signal failures of post-apartheid South Africa and of the ANC government since 1994 has been a failure to deliver good quality basic education that delivers critically literate citizens. Now, we can think of this as accidental, but I think historians of the very near future are not going to be as kind to us and are going to suggest that this was deliberately done as a design to create the kinds of problems that we see in our political system. That being said, what also needs to be borne in mind is that the climate emergency is unfolding alongside, and it's causing the unfolding of a whole series of other crises, including the kind of economic ravages that we're beginning to see across East Africa and South Asia. But one of the central concerns in South Africa is the large gap between the majority of the population, who are young and will be living into the second half of the century, and our governors, who are all mostly over 60 and will probably not see 2040. And so these people, like politicians the world over, govern for the short term. They're thinking for the next election and possibly maybe 2030. The majority of young people in this country who will live into the second half of the century have to have a much longer view. And that, I think, is part of the disconnect in our societies. It's not just that parties are not proposing policies on climate change mitigation. The very language that is being used often contradicts one another. So politicians will talk about we need growth. Yeah. When across the world, we know that, unmitigated growth is part of the problem of what has caused this crisis. And we need to begin to think much more creatively about how to design an economy that benefits more people and also at the same time does not destroy the only planet that we can live on by destroying the climate that we have adapted to over the last 12,000 years.
Okay, Professor Bloomberg, I'm going to give you the final bite. What are some of the lessons that we should be taking from COVID-19?
So I think the one message, there are many lessons. We need to have much stronger health systems, resilient societies. But I think the message, the immediate one, is there are definitely vulnerable groups during COVID, hypertensive, diabetic, obese, people over 60, those with chronic conditions, immunosuppression, really need to protect themselves from COVID infection. Those are the patients who are going to be at risk of hospitalization and more severe disease. And we need to use all measures we can to reduce the risk of infection in that group. And we don't have lots. We have masking, we have distancing, we have hand washing, we don't have vaccines yet. But that is a group we need to protect from COVID. And people need to take responsibility for themselves. Okay. For reducing infection. Thank you.
Professor Bloomberg, just before I let you go, there's one question that I have, and which is not in relation to the conversation that we're having, but I saw an article earlier on indicating that some scientists saying that the COVID-19 could be airborne. Are we doing any research on that?
So I think that's a question that many people are asking. I think for the majority of instances, it's probably droplet spread. I think there are some activities that may, pose a risk of possible airborne spread. I think there would be far more infections in many areas, but that's the hot question of the moment. And watch the space. We'll see.
Okay, then thank you so much, Professor Lucille Bloomberg, as well as Angelo Fick. Earlier on, we were joined by the MEC for Health in Gauteng. Thank you so much for joining Unfiltered with me, Aldrin Simpier. We're back again next week, same time, same place. Enjoy the rest of your evening.